If you're going to have a colonoscopy, one of the first things you'll need to do is bowel prep. Bowel prepping is a combination of eating a particular diet and drinking a bowel prep mixture that you buy at the pharmacy. As a patient, you play an important role in your colonoscopy. Without correct bowel prepping, colonoscopies are much less successful and sometimes even have to be repeated. 4 days before your colonoscopy, you're going to want to start what's called a low roughage diet. This means low vegetables, fruits, nuts and seeds, popcorn, and whole grains. It's probably the only time that we as doctors are going to ask you to eat less of vegetables and healthy things, so go ahead and take advantage of it. The day before the colonoscopy, you're going to want to start mixing the bowel prep first thing in the morning. The reason being, this way it'll have more time to chill in the refrigerator. Colonoscopy bowel prep always goes down easier when it's cold. You prepare your Golytely bowel prep by filling the jug up to the line with warm water. Next, you mix it until all the powder is dissolved. And then place it in the refrigerator for the rest of the day. The day before your colonoscopy, you'll start your clear liquid diet. We say clear liquids include drinks, broth, jello, and popsicles, as long as they're not red or purple. Red or purple drinks or popsicles can confuse the colonoscopy by looking like blood during the exam.
I can't live without my coffee!
It'll be okay. If you must have coffee the day before the exam, you can have it, even during your clear liquid diet, but keep it to a minimum. And no milk, no cream, only sugar. 6 o'clock the night before your colonoscopy, it's time to start drinking your Golytely bowel prep. You drink it 8 ounces at a time, 10 minutes between each glass, until you've finished 8 glasses or 64 ounces. Okay. Since 8 ounces is the same as 1 cup, you can measure 1 cup of water and pour it into the glass you're going to drink from, then mark it with a piece of tape or a marker. It's best to drink your bowel prep quickly, not in little sips. If you start to feel sick to your stomach, take a break and then start drinking again once you feel better. As always, bowel prep goes down best when it's kept cold. Here's what you should expect. 1 to 3 hours after drinking your first glass, you'll begin having loose stools, or possibly even diarrhea. This is normal, and you should continue drinking the rest of the prep. You may want to consider having some Vaseline or baby wipes on hand in case you get sore from all the wiping. The morning of your colonoscopy, you should continue your clear liquid diet. 6 hours before the start time of your colonoscopy, you need to start drinking the remainder of your bowel prep, 8 ounces at a time, 10 minutes apart, just like before. Starting 4 hours before your colonoscopy, you should not have anything to eat or drink. This means no liquids, no food, no mints, and not even any gum. By this time, you should be having clear, liquid stools, and this is normal. So, remember these 4 key points about prepping for your colonoscopy. Number 1, the day before you should be on a clear liquid diet. This means broth, liquids, jello, and popsicles, but nothing red or purple, and no cream or milk even in your coffee. Number 2, drink your Golytely bowel prep 8 ounces at a time, 10 minutes apart, and it'll always go down easier if it's cold. Number 3, you will have diarrhea. This is normal. Keep drinking your bowel prep until you are finished. And number 4, nothing to eat or drink, not even gum, 4 hours before your colonoscopy. So remember, bowel prepping is one of the most important parts of colonoscopy and can ensure whether a colonoscopy is successful or not. If you have any questions regarding the instructions for bowel prepping, call your doctor's office and they'll be happy to talk to you. Cheers!